Hello everyone, this is Karen Grace Clark, IBCLC and Program Director of GOLD Lactation Online Conference. Welcome to our official closing ceremony for GOLD Lactation 2014. It's wonderful to have everybody here online with us today. And of course, I also have my co-MC, Fiona Lang-Sharp. Hi, Fiona.
Well, hello everybody, and I am Fiona Lang-Sharp, IBCLC, and Public Relations Coordinator for GOLD Conferences. What an amazing time we have had this year. I can't say enough about the feedback that we've been getting and how much I personally have enjoyed myself too. So much learning has happened, and I feel like I want to just absorb it all. So welcome to our closing ceremony. We will be talking about some of the things and the great highlights that we had this year. Back to you, Karen Grace.
Alrighty then, so we're just going to go ahead and go through the PowerPoint here. Fiona, if you just want to click through on the next one, you have, the next one is yours, and we've got some speakers here to say thank you to.
That's right. We certainly do have some speakers to thank you to, but this is the challenge, everybody. So everyone that's listening right now, I'm going to give you about 30 seconds, and I want you to name the speaker. So type it in the box right now. Who do you remember? Recognize the faces. Everybody, go. Well, Karen Grace, of course, she's going to be trying to win this competition. I really wanted the Jeopardy music right now. Anyone? Do, 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 do. You've got 30 seconds. Type them all in. Virginia, yes, Virginia's there. I see that, yeah. Nils. Ruth got that one. Aren't they beautiful, though? They're beautiful speakers. Melissa Cole. There's Lisa Marasco. Nancy. Oh, Marion got that one. Fabulous. Oh, look at Rosemary. She's just got them all. Oh, yeah. See? I think she cheated. She probably had those all written up already. Well, we want to shout out to all of our speakers that you can see on the slides here. And we want to say a big thank you for all of their commitment. And let me tell you that in doing the training that you don't hear. It's an amazing experience to work with all of these wonderful speakers and how dedicated they are and how passionate they are about the work that they do. And they really want to bring their A game every single time. You know, they see it as a real challenge. Some of them have never been on online conferences before. So when they present, sometimes they're really nervous and you don't hear the background stuff. But honestly, they just want to be perfect and eloquent for all of you and bring and share all their knowledge. So we're very grateful that they just work so hard to come to us and that we're able to give them such a great exposure to all of you. So thank you to all of our speakers on our slides here.
Thank you,
Here we go,
Fiona.
Kate.
You know, we're often, thinking like, a year or even 2 years in advance. I come across, speakers either at other conferences or via the journals or industry events or in so many other different ways. And so many times I come across a piece of information or a presentation I may have heard elsewhere, and I'm like, wow, that would be awesome for GOLD. We have to get this person on GOLD. There's so many wonderful researchers and clinical specialists and individuals with cultural presentations and whatnot. And we do try to bring you, new people every year. And then of course there's the favorites too. There's the people that we really want to hear from again and again and again. Especially those who are doing research and can really help us refine our clinical skills. And that said, it's a challenge as well to make sure that we get a well-bodied, list of speakers and presentations every year to kind of, make sure that we've got a good overview of what's going on in lactation in the world at any given time. So I'm always proud of the end result, Fiona. I'm always proud of it. I'm happy to say that I always feel confident that what we are providing, the education we're providing, is what people are looking for. And that said, we really appreciate hearing from our delegates as well. So please make sure you let us know. So this is going out to everybody listening today. Let us know what it is you want to hear. Let us know the people that you want us to bring in to speak. Let us know the topics that you're interested in, because we pay very, very close attention to that. There's Hetty saying, as always, this is my favorite online conference. I just love gold. Thank you, Hetty. Okay, we're going to play speaker bingo. Okay, we're going to do something a little bit different with the speakers on this page. So, all right, really quickly, who's the first person that can tell me the speaker second row, second from the left? 1, 2, 3, 4. Nobody's got her. Let's see. What about the speaker fourth row, all the way over on the right-hand side? Who's that? What about the speaker on the bottom row in the middle? So here we've got, yep, Diane Cassidy. Yep, she's the one on the second row, second from the left. What about the fourth row, all the way on the right-hand side? That's Cynthia. Yep. And what about the speaker on the bottom row in the middle? That would be Helene. Is that Helene or Helena? I'm never sure how to pronounce that name. But there we go. So these are some of our speakers too. As you can see, if we toggle back and forth between this page and this page, we have just a really great roster of people, that presented at our conference this year. So really awesome. Thank you so much to all of our speakers. Alrighty then, it is Andrew's turn. Andrew is actually going to talk about the GOLDies Awards. So Andrew, you go ahead and come online and let's have some fun.
Thanks, KG. I had to scramble and find the notes that I took for this. I was trying to keep track of who is doing what in terms of discussing the speakers' names, because we do have some things we want to give away today, and definitely want to acknowledge the people that participated in a few different awards that we ran this year. This is our first time doing some kind of official contest stuff, and well, we had fun anyways, come up with the ideas, so we'd like to go through them. So as you can see, the first one we put up there is the Social Butterfly Award. And so this presentation is dedicated to our delegates who have really been going out of their way to promote us on their own accord through Facebook, through Twitter, other areas that we've connected on Pinterest, etc., and just telling their friends about what a good time they're having at the conference. So really appreciate the support. And so what we asked was that you tweet using our official hashtag, which is GOLDLACT2014. And we were trying to keep an eye on people who were doing that, as well as on Facebook, people who are liking and sharing our conference-related posts on our webpage there. So we were really trying to track who was doing what, but we had some very obvious winners there. So I want to announce now, I think she's here, and I just want to make sure our winner's here. Oh, yep, and we have a drum roll. Why not? Thanks. Our winner is Helen Gray. So Helen Gray, congratulations. Thank you very much for being our social butterfly. She did an absolutely phenomenal job with promoting us and telling everyone about her experience. And we'll be offering her a choice of either a registration for our upcoming perinatal care conference or our upcoming lactation conference next year. So thank you so much. Very much appreciate you. And our next one is for our Loving Live Awards. So this is one that we're, sorry, and I'll just get my colleague to mute there really quickly. This award for Loving Live is for the attendees who have actually been attending all of our live conferences. They're coming to the conferences that we're running live all the time. And we just really want to acknowledge people that have attended and gone another way for this, showing up at 4 a.m., 2 a.m., 12 p.m., it didn't matter. They were there alongside of us. I'm not even sure, like we had some delegates, I think, who attended more live presentations than any of us working on this conference did, because we came in rooms at different times. So yeah, I'd like to give out 5 of these actually, because we had so many people that were doing this. I'm just gonna go through the prizes really quickly. I'll be in touch with the winners afterwards. But for the prizes, we had a lot of books donated by our speakers. They sent in books that they have written, which is amazing. We really appreciate that. So we're going to pass it along to our delegates. So the prizes we have to choose from are a basket of books from our speakers, the tongue tie add-on in 2014 that we have here, pre-term add-on, the gold annual membership for free, or a attendance at our next alumni presentation in 2015. So that'll be early in the year. So I'd like to acknowledge our top 5s. So starting with the first, Rosemary. I think it's no surprise, Rosemary, that you've gone totally out of your way this year to make sure that you were with us as much as you could be. So thank you so much. I know that you worked some crazy hours to be able to attend. So we really appreciate you coming in, interacting, and being our top Loving Live delegate. So thank you so much. I think she attended actually everything, and including the closing ceremony today. So it's great that she's here. Thanks so much, Rosemary. We'll be in touch with you soon. And our runners-up are Vicki Swanson. Vicki, thank you as well for being here. We've got Ivelina Staniva has also been, she's our number 3, followed by Lynn Foster and Kara Stadham. Those are our Loving Live speakers, or Loving Live delegates, I'm sorry. And let me just pull up my contest page again. The last contest we ran was for a selfie award. So this is for people we asked, you know, just have some fun, have people post a picture of themselves enjoying our conference in a unique way. So some people sent screenshots of them and their favorite presentation, or a lot of delegates sent in pictures of themselves breastfeeding while they were watching our conference. That was pretty amazing. So that was really great to see, and to see those photos come in. So a lot of people sent those on Facebook. So thanks everyone who did that. We got about 9 of them, so we really had to hands down give it to Julie Bouchard, who sent in a photo of her feeding both of her children at the same time while watching Gold Lactation and navigating the presentation. I believe it was with her foot, so it was pretty impressive. We had to give her the award. So we'll be asking her as well if she'd like to join us for our perinatal conference or for our lactation conference next year. Yeah, Kathy, I'm wondering if we didn't have enough time. We thought we'd just draw randomly today or see what we can do, but we'll definitely be able to share that photo with everyone if she's up for it once we send out a next mailer. So thanks so much, everyone. It was a lot of fun to run the awards this year. Thanks for your participation.
Thank you, Andrew. That was awesome. That was a lot of fun, and it was really actually so great to see people participate both in the selfie award and the social butterfly, and of course to see familiar names attending the live presentations frequently is always such a joy, because we sort of feel like we're building a community there, and that's awesome for those of us who are online all the time as well. Okay, we actually have an announcement. So I wanna do that drum roll again. Can I click it if it works? Let me see. Oh, it's working. Can you guys hear that? I'm hoping everybody can hear the drum roll. There it is with the clash at the end. All right, so we have a very important announcement, and that is the Gold Learning website is going to be launched very, very soon, sometime this month. Well, actually, no, next month, because today is still May. But the Gold Learning website is where you can purchase repeats of the of Gold and the perinatal conferences, and we will have our add-ons there as well. And eventually, a few months down the road, we will have individual lectures from our conferences as well. So we've been working on this diligently, wanting to get it up online for all you guys who want to purchase, one presentation, or just, maybe have colleagues who just want to purchase one of the add-on packages. And this will become a precedent for us that will put content up there after every time we have a live event. So we're really, really excited about this, and we hope you will share the good news once we have this website launched. We'll make sure to send you information about it in our newsletter, so do watch that. Karen Grace deserves a special award for phenomenal conference organization in light of personal struggles. Aw, thank you. That's actually true. You must follow me on Facebook. We won't talk about what those struggles are, but we'll just say that I had a battle that I had to deal with. But in the end, I actually won, so we're good. We're good to go. But thank you, Linda, for saying that. I appreciate that so much. I do feel the love from you guys, and I really enjoy meeting everybody at other industry events as well, and we're going to talk about that in a few minutes. Alrighty then. Well, Fiona, do you want to let our delegates know which speakers we have online with us today to do a bit of a live Q&A, and invite them to then post questions in the chat box, and then we will handle that in just a few minutes. Fiona.
Yes, indeed. Well, as you can see on our screen here, we're going to have our live question and answer session now. What we're going to do is we're going to have you start thinking and writing your questions now. We'll capture them like we do in our other sessions, and then we're going to ask them a little later on. But I do want to introduce Allison Hazelbaker, James Murphy, or Jim, and we've got Veronique Darmangent. I probably didn't say that wrong. I'm very sorry. And Amy couldn't make it today, and we have Virginia Thorley with us here as well. So you can see the title of their presentations. Some of you may have actually been in those presentations, and some of you may be thinking that you had more questions for them. So we would love it if you would take the time now just to think about those questions while we go through some more of our exciting slides and show you what also is coming up. So just kind of take your time. We're going to be starting with Allison at the top. So if you are thinking of questions, get your questions ready for Allison first, then Jim, then Veronique, and then finally we're going to have Virginia. So, like I said, this will happen just momentarily here, but we will give the opportunity for all of you to think of those questions right now. Okay, let's move along here. Whoopsie, here we go. I'm jumping ahead. Now, was this you? I can't remember, KG. Are you introducing our perinatal?
It was me. Yeah, it was me. I'll handle this. And well, I guess you can too. We could share it. We're good at sharing.
Okay, we can share. We can share.
We can share. We can share. Yeah, I think one of the most fun things for me, you know, is the podcast that we do, Fiona. As we're leading up to the conference and as the live days are actually unfolding. And then you and I sort of meet online, you know, 2 or 3 or 4 times throughout the conference and record these podcasts. We talk about the highlights, the things that delegates can do to have a better conference experience. We talk about speakers that we've been dealing with, and it's a really fun experience for me. I enjoy it a lot, and we share a lot then. You know, it's kind of a give and take, isn't it? So we get our groove on, don't we, Fiona? We get our groove on.
We certainly do get our groove on, and I think that's one of the things that we've been able to niche this year is a lot of the things that K and IG, well, they run very similarly, you know, along the lines, even personally in our lives. And that's why I think that we work well together as a team on these things. And when we first started talking about doing the KG and Fifi show, you know, we had all of you in mind. And I say you as in our delegates, because we really just wanted to bring to you another element of what we're doing here so that you understand that, you know, we don't just sit behind our desk. Like, we're very dedicated to, you know, what we present, how we present, you know, what's happening, what it really interests us, and what's new. So and that's how we talk like this when we're in meetings, by the way. So this is, you're getting a real inside scoop to seeing what it's like when we're in meetings. We go back and forth, and we're always trying to, you know, agonize over what we can do next and how much better we can make gold for all of you. So it has been fun, and so I hope you'll enjoy going on to our YouTube channel, and you'll also see some of the interviews that we did, but you'll also get a chance to listen to, of course, the KG and Fifi show. So we've had a lot of fun this year doing that for sure.
For sure. Now, I will mention, while people are still typing up their questions, for our speakers who are waiting for their question and answer, I wanted to remind everybody about our Gold Perinatal Conference coming up this fall, and that is going to be an annual event as well, so you can set aside some time in the spring for Gold Lactation and then in the fall for perinatal. Now, of course, the Perinatal Conference is, you know, that sort of late pregnancy, you know, childbirth, early postpartum type of conference. We do have some breastfeeding focused content there, but it's really for that healthcare professional that's working, you know, within that perinatal, within that maternal child health, you know, framework. And we've got lots of great presentations coming up this year. I'm just really excited about it. Look online at goldperinatal.com. We will start to publish that early this summer. And just wanted to point out some key notes here, some key dates. So registration will open for Gold Perinatal on August 1st. Our keynote presentation will be on August 14th. Our live days for Gold Perinatal will be October 20th and 21st, 27th and 28th, and then the closing ceremony will be November 30th. So last year, we kind of started everything in November, and then we ended it December 31st, and we felt that this year we should move it up a little bit so that it was really in the fall and kind of not interfering with holiday celebrations around the world. So looking just, again, just for a few minutes here before we get to our question and answer sessions, we've got some of the speakers coming up at Gold Perinatal. We've got Diane Weisinger, I never know whether it's Weiss or Weiss, but somebody will set me straight. And she's going to be talking about infant reflexes and feeding behaviors and how they're affected by the birth process. So this is, again, you know, this sort of comes around every 5 years or so where people are really starting to focus on that birth process. And we're finding in social media and in blogs and in research that this is being talked about again. And we really wanted to bring Diane, you know, to our speaker roster to address this for those nurses and midwives and doulas and physicians who are, you know, working in that that framework. We have Andrew Bissett, who's going to be talking about breech birth. Now, I don't know if you've been watching, you know, the research and the information that's coming out there, but there's more and more information coming down about the safety of vaginal breech birth and, you know, how it's on par, if not a little bit better than the risks of cesarean for breech. So not really sure what Andrew is going to say, what Andrew Bissett is going to say, but we're really interested in hearing current practice for breech birth. Now, Rebecca Decker is going to talk to us about her recently published information on vitamin K. And what the evidence is there. And I will say I was surprised. I was surprised by what she discovered. And it's definitely something we wanted to share with our audience. So that's going to be an awesome presentation. We've got Lynn's staff talking on current thoughts on cesarean birth. So that'll be really interesting. This is, of course, a discussion that's constantly being talked about. Show, you know, the cesarean rates and how do we, you know, reduce those rates, but moreover, how do we ensure that mothers who are undergoing a cesarean have the best birth experience that they possibly can in those circumstances. Hensi Goer is going to be one of our speakers as well, talking about electronic fetal monitoring and what the impacts of that can be. So that's going to be awesome. Amy Gillian is going to be talking about utilizing fathers in the perinatal period. Christina Canton, opoid use in the perinatal period. So really, really great presentations. Lynn Staff, oh, that's on there twice. I just mentioned that. Sonia Miles, the relationship between IV fluids and breast changes in the postpartum period. So that is really interesting. Now, you know, Gold Lactation had something very similar about 4 years ago from Joy Noel Weiss, and she gave a presentation on this type of topic. And actually, Sonia, I believe, works with Joy. And what they're doing here is expanding on this topic so that it is very appropriate for the healthcare professional, not just the lactation professional. So highly recommend that presentation as well. And then we've also invited Susan Berger to talk about assessment and interpretation of newborn weight gain. And you know what, this is just a sample. This is only, you know, maybe 2/3 of the speakers, maybe only half of the speakers that we'll have for you at that conference. So really hope that you take the time to register and join us for our upcoming Gold Perinatal Conference. We will send you information in our newsletter, and if you don't mind sharing that with other healthcare professionals you know, because of course it's not focused on the lactation consultant, it's for the nurse, for the midwife. LCs are more than welcome to join because it is appropriate for them, for the midwife and doula and physician. So it would be great if you could help us spread the word on that conference. All right, we're going to go back to the Q&A page, and I think we are ready to get started with a few questions there. So Fiona, do you want to invite Allison to turn on her microphone and then jump in with some questions there for her? I'm going to mute while you do that.
Whew. Well, that was very exciting news about perinatal. Did you guys all hear that Hensi Goer is going to be there? That is very exciting. I know Angela Torres has her ears just perked up, so she's great in the birth world, so that's very exciting. And she has written so much good information, so I'm excited to hear her, and many, many other names as well, so that's fantastic. So, Allison, are you available? We would love to hear from you. Allison Hazel Baker, just amazing. She has presented for us before, writes a book on tongue tie, which... Hi, how are you, Allison?
I'm great today. Thank you so much. It's so exciting to be here.
Well, you know, it's always exciting to talk to you, Allison, and, you know, always a pleasure having you at our Gold Conference. But let me just tell the delegates that I've had a chance to chat. Allison probably doesn't remember me, but we always meet in the hallways of conferences, and then I always track her down. And then, but maybe you remember that time we sat on the floor for a couple of hours and we all chatted for a while, and it was just, we had such a great time talking about babies and how they respond at the breast and all those types of things. I think that might have been in Florida even, maybe.
I remember that well, and to me, those are the favorite times at in-person conferences. Is not what goes on in the presentation rooms, but what happens in the hallway.
Exactly, exactly. Yeah, we did have a very good time that day for sure. So as you can imagine, Allison, we've had some questions come in for you and Jim as well, and I've just kind of split them up a little bit, but I'm just going to read this one for our delegates so that they don't miss it, and I'll ask KG if you can just grab any questions that were coming in there, that would be great as well. But here is a question from Amy. Amy says, this is for both actually, for Drs. Hazel Baker and Murphy. We have a big problem in our area with dentists and ENT providers who are not up to date on the research about tongue tie, lip tie. Moms with nipple agony and babies who are not gaining weight are routinely told that their baby's ties are not severe enough to warrant a surgical intervention. Any suggestions on how we can reach out to these providers and get them to actually read the literature?
Oh boy. Okay. So, you know, this is the big bugaboo when it comes to tongue tie. So I'm probably going to stir the pot here a little bit, and you know, Jim's got his viewpoint as well, and it's a really valuable one since he's one of the quote-unquote bad guys as a physician, and actually he's a good guy, but you know, physicians and especially ENTs have been resistant, but not everywhere. So I think that really this is a process of education, and lactation consultants shouldn't be afraid to ask the local dentists and ENTs and pediatricians to just go and have a coffee with them and take with them the most recent literature. There's a ton of literature on this, but if you just choose 5 or 6 really good solid studies, and there are 6 randomized controlled trials out there. So the gold standard, quote unquote, the gold standard in research, there are 6 of those. And if you can get your hands on those, it's not difficult to. If you go to PubMed, you can do a search on them. My book has a extensive bibliography in it. You will be able to find what is considered the gold standard. You go armed with those, and not in an attacking kind of way, but in a sharing kind of way, and you share. You share what you know, and you share what your concerns are. We can't make anybody do anything, and that's, you know, we wish we could. We wish we could just simply say something and have somebody believe it and act on it. But you have to remember that they've already been educated in a different way. Now, alongside of that suggestion, I would say start with your own dentist. Start with your own dentist and take to them what shows up in the literature in regards to the dentists that are doing this work. And that's going to be Larry Kotlow and Marty Kaplan, take that information with you to your own dentist, because you already have a relationship established with that particular individual, and just talk with them. Oftentimes, if they're not interested in learning how to do this, or perhaps maybe getting a laser, and that's how Marty started. You know, he's just a regular old dentist, and he found out about this, and it sparked his curiosity, and he talked to Larry Kotlow, and then he got himself a laser. Same with Greg Notstein. The local La Leche League leader came to him and said, please, 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 please do something talking about this, and now he's done over 6,000 frenotomies and got himself a laser recently in the last few years. So you have to start somewhere. It's not going to happen overnight. You have to cultivate a rapport with the individual who you have targeted, and target one. Just start with one person. And from there, you'll be amazed at how that will mushroom, and pretty soon you'll have a group, a small group in your community that is willing to take this on and be responsive to it. That's really what I've heard back from people around the world, wherever they are, that it is starting with one individual and really taking the literature, because there's a lot out there, and that really begins the process. And I'm sure that Jim will have some suggestions as well.
Yeah, it really is true that it starts at home, and I've taken that suggestion of yours before, Alison, and I took it actually firstly to my pediatrician, who has been around for a long time. He's a wonderful pediatrician to me, anyways, and he understands how I work. And I brought it to him. I wanted to know. I just drilled him as soon as I got in there when I, had seen one of your very first sessions and said, okay, what can you tell me about tongue ties? What can you tell me about a posterior tongue tie? And he knew nothing. And this is a man who I believe to be well educated, who's been around for a long time, who treats my children. So I knew then that, I needed to change my approach and not have the expectation that people are just going to come around to this. This is going to be something they're going to turn on to. This is something that's going to take time, and it does start at home. And so once I realized that, I thought, okay, I need to talk to as many professionals that I know personally, that I already have a relationship with, and then start from there, because that's where the seed is planted and where we can move forward with all of this. Would you not agree, Alison?
Yes, absolutely.
Awesome. I didn't really give you much of a choice on that, but I know that that's what you're trying to say. Okay, so here's one from Amanda as well. She says, also, what can be done for lip ties in communities where there is no one to clip or laser them? What is recommended these families do to help support breastfeeding?
Okay, so I'm going to stir the pot again, because I'm very conservative when it comes to the upper lip tie phenomenon. There's really not a lot of research on this, and in my personal experience, it's being overdiagnosed. So, it's about function. So even if the labial frenum is attached lower down on the gum line, depending on how elastic it is, depending on whether or not the lip can flange and the baby can flange it on their own, depending on if there are other structural restrictions, depending on how thick and fibrous it is, depending on how much of the upper gum it is collonating, all of those factors are going to play a role in making a determination as to whether or not it needs to be clipped. So, because careful diagnosis is going to probably cut back on the number of babies that you actually need to refer, that's going to solve some of your problem. So our obligation is to get better at doing the functional assessment. And I personally don't agree with Larry on this. He's coming from a dental perspective, and I'm coming from a breastfeeding perspective. And many of the ones that I've seen him clip, I would not have sent for treatment. So, and I know Jim's going to have his take on this as well. There is only one study on upper lip tie, and then Larry wrote an article that appeared in either Clinical Lactation, I think it was Clinical Lactation, presenting his classification system. So we're really on the beginning cusp of our understanding about this phenomenon, and we really need more information before I think we need to go off half-cocked about it. So I would really encourage you all to do a functional definition, and if that baby can flange it all with good technique, it probably doesn't need to be done.
Excellent points. I think that's great, and I realize that everyone in the field is going to have slightly varying opinions on this, but I think it's great that we don't all agree at this point, because we are still very early into this lip tie phenomenon, as you mentioned. Okay, so moving on to Rosemary, she has a question. She said she hasn't had a chance to actually listen to the add-on. She said maybe this was covered, but she wants to know what is the difference between, in your opinion, between laser and scissors cutting. She says we only have 4 doctors in Cape Town area who will do a release under local anesthetic.
I have a little bit of a question about doing a release under local anesthetic. Does that mean that they do it because they think it's a good idea, or that you want them to do it, or you want all of them to do it under local anesthetic? So if Rosemary could just clarify that piece of her question, that would be great. And while she's doing that, I'll answer the other part of it. Okay, so should it be scissors or should it be laser? Well, that's like $1 million question. And again, we're at the beginning of our exploration of this subject. So I'm going to share my opinion about it. And I'm sure Jim will weigh in on this as well. I kind of like scissors personally. And at the same time, I'm really supporting the people who are doing laser to really refine what it is that they're doing. Marty Kaplan, who is on the East Coast of the United States, is doing a wonderful job of experimenting with different lasers, different amounts of time, different settings on each one of those lasers, and doing a compare and contrast. At this point, he's accumulating case histories and videos, and what he is finding is that as far as the laser is concerned, it all depends on the amount of training the practitioner has had. So if somebody is not very good at using a laser, no matter which one it is that they're using, they potentially could really botch the job. Same thing is true with scissors. Bottom line is, no matter which one is being used, that practitioner needs to know what they are doing. You know, I've seen practitioners do really great scissors work. And then I've seen other practitioners that do really great laser work. One of my concerns about the laser, well, I have 2 concerns about the laser. Number one, it's expensive. It's more expensive than doing a scissors procedure. So I think that has to be factored in. Realistically, that needs to be paid attention to. Number 2, my personal experience, again, is that my babies have a little bit more difficulty recovering from the laser treatment, and in fact, I've had some breast refusal for days post-laser. I brought this to Marty's attention, and he said, well, I think that's because the practitioner may be using the wrong setting, and they may be heating up the laser too much, and that will lend itself to soreness. So again, I think this is a matter of training. The jury is still out as to whether or not one is better than the other, and maybe we're going to find out that, you know what, they're both good, and it's going to be a matter of preference. Certainly the laser cauterizes as it goes, but you know, there's very little bleeding to begin with. So, you know, I use both. I refer to Dr. Nodstein because he lives close to me. I refer locally to when I've got anterior or a type 3 posterior. I refer for scissors right here in town because it's faster. It's hard to get in to see Greg because he's inundated with this. So I think you kind of have to weigh it out and get some personal experience with this. And as the dialogue and dialectic continues about scissors and lasers, or electrocautery, because that's another approach that's being used in Australia, for example, that we're going to see more research being done on this, and that's going to help to better inform us as to what's what.
Well, it was great to hear that we've got somebody who's actually doing some research in this area. I do live in a privileged area like you where I have the opportunity to use both as well, but I think really the jury is still out in many cases of you know, where we need to go. So moving on to Linda's question, she says, Allison, is it possible to get a poster with information, website, and your books so I can provide them to all the doctors in the community as I give them information about twice a year Oh, KG just lost my question. Sorry about that. About twice a year during Breastfeeding Week and the IBCLC Day.
I'm not quite sure a poster with what kind of information, so if you could clarify that that for me, Linda, I'd appreciate that. My website is www.AllisonHazelbaker.com. Our telephone number at my office where you can order books, because I own a publishing house and I publish my own books, is 614-451-1154. And I'll type those in the chat room as well here as soon as I'm done. Oh, Andrew's taking care of it. Thank you. So, you know, that's how you can get a hold of my stuff. Now, as far as the DVDs, I am coming out with them. They will be available at the ILCA conference for the first time. So there will be, I'm hoping to have 6 of them done. One of them is about using the hat lift. I hope to have the faux tie one done as well. And the to clip or not to clip with all of the evidence and all of the citations in it will probably be something that will get done later on in the summer. And those are all available, you know, by calling the same number or by going to my website.
Well, that's fantastic. Thank you so much, Allison. And as you can see, we've wrapped up most of your questions there, and that was Sandy's last question there. She addressed that about the DVDs. So as you can see in the chat box, we've got Allison's phone number, and Andrew's popped in there her website. That's awesome. So thank you so much for joining us today, Allison. It's been a delight having you again, and always a big topic of conversation. So thank you for being with us. We are going to move on to Jim now. So if Allison, if you just want to say goodbye and then you can mute yourself, that would be great.
Thank you so much. And I just wanted to mention before I leave that my daughter just had a baby. The baby was not tongue-tied, and she was born at home, breech, double footling. So I'm glad to see the Canadians getting onto the research and changing the way that they do things. I hope we follow soon here in the U.S.
That's great. Thank you so much, and congratulations. Good job. Okay, Jim, are you there?
Oh, yes.
Oh, hello. Well,
I have a few ideas of on the questions that have been asked so far. One thing is that when you want to get somebody to over to your side, be it a dentist or a physician, the one thing that always seems to work is food. Take them to lunch. You take them to lunch and you bring the articles along, and while they're eating, it puts them, you know, all those endorphins are getting them in the right mood, and you're talking about the articles. You can really get them to consider more of what you're saying. So that's what we did with one of our ENT docs out here, and now he's one of our prime releasers. But he wouldn't touch posterior tongue ties until I spent about 4 hours with him. So what I did with the other people in my department, I was a pariah when I first started doing this in 2004, but I dared anybody to have the guts to send a kid who was having tough time breastfeeding to me to see what I could do about it. So they thought that I would probably cause a problem, and they sent them over. I fixed them. They went back. The mother just sings your praises, and they go, yeah, okay, fine. Well, sometimes it takes 5, 10, 15 of those before they're on your side, but little by little, you develop a critical mass of your colleagues on your side that you can then use as references to go after the surgeons who are more likely to want to do the release. So we've had no problem getting an ENT doctor in our hospital to do it, but none of the other surgeons wanted to have anything to do with that. So we only have one in a very large medical center, and we have a half dozen in our county. So we're working on it. I consider myself Johnny Appleseed. Everywhere I go, I get one doc to start doing something. And then little by little, they do a little bit more and a little bit more. They do like I did when I started. They released the anterior ones, the little membranes that have no blood vessels and no nerves, so that you can release those and you get a little benefit. Then you see, well, you didn't get all the benefit, and little by little, we get some people to release the posterior tongue ties. And as far as the laser versus the scissors, I've always been a scissors person, and cost, it is more for a laser, but I'm looking into that now as to acquiring one, because when I use scissors, they were $65 a piece. We've got 15 of those, and then the groove directors, then the autoclave to clean them, the ultrasound cleaner, So you're up to somewhere in the neighborhood of $2,300, $2,500 just when you're using scissors. And you have to meet all of the requirements for documentation of how you're cleaning them and sterilizing them. So with the laser, you don't have any of that. You just have the laser, and you buy the little worm that feeds into it. Each time that you use it, you cut off a little piece of that fiber optic cable that goes down the laser, and then you use it until that's up, and then you get another string to put in there. So the lasers can come as cheap as $5,000 to $6,000, and they can go up to $40,000. So my problem with the scissors is that the parents, no matter what we tell them, it takes 15 to 20 seconds to clip even the worst posterior tongue tie. We get that released, we take the baby off the table, put the baby to the breast, and if the baby latches right on, everybody's happy. If the baby takes 15 seconds or more to latch on, the parents are convinced this kid's in terrible pain, and they go out thinking that, even though they're delighted with the way the baby is breastfeeding, and it's wonderful that they can now enjoy breastfeeding, they're still thinking, I wish I didn't have to put my baby through all that pain. And I'm thinking, there was hardly any pain. What are you talking about? But that's the parent versus the provider. And with the laser, it takes several minutes. When I asked Dr. Kotlow what do his parents say when they're watching him do the laser, he says, oh, I don't let the parents in the room. They go outside. We just have my assistant, myself, and the baby wearing laser glasses to protect the eyes, and we release it, and then we give the baby to the mother after the baby's already been calmed a bit. So it takes several minutes to do the tongue tie. It takes several minutes to do the lip tie and do a good job of it. And the baby is usually crying this entire time, as Larry admits. So when a baby's crying, they think pain. So I'm not sure, even with the laser, whether I'm going to be able to convince the parents that it's not hurting. But for sure, you don't get any bleeding with doing it because it cauterizes as it goes. And as far as the attitude afterwards, the community, all the blog sites are buzzing about how wonderful laser is. And these are people who have no idea. They read an article, and we've had a number of people who booked an appointment with me because they failed with a previous scissors. They got a referral to come to me, and then they called the day before and canceled it. They say, the grandma says I should use laser, so we're just going to go up to this other person who uses the laser, but who doesn't do any follow-up. And my feeling is, just as Allison said, it's not the equipment, it's the operator. It's an operator-dependent procedure, and we have people in the Academy of Breastfeeding Medicine who release tongue ties using a suture removal kit. If you're good, you're good. The equipment doesn't really make that much difference. I did the best equipment because I planned to be doing this for a long time and I wanted to have the best stuff. But I mean, you can even do it with your fingers and suture removal scissors. So it can be done well, and it's operator dependent. I think that pretty much covers the questions that we've had already. Did I miss anything now?
First I want to say, thank you, Jim, for being with us here today. I didn't want to interrupt you at all because you were just addressing all the points that we've had. But I was making notes as you were talking. First of all, I love the idea of food. Who doesn't love that? I think that, if you build it, they will come. If you provide food, they will come, right? So,
yes, doctors and dentists will come.
Yeah, exactly. And I also, you touched on something which I think is a really big topic. Probably don't have enough time for it today, but I personally see a lot of this in my practice. And I see a lot of families who have the tongue release done. Now, predominantly, we're using laser in our area, but we still use scissors as well. But either or, it's the parents that have the biggest impact on whether they're going to be successful or not. That's what I'm finding right now. So it was very interesting hearing that comment from you. I think I need to spend more time with the actual providers like yourself, just sort of talking about it, because once, the parents decide that Johnny is in pain, they do have a much harder time dealing with this. And the recovery time seems to be slower. It takes longer for the babies to go back to the breast. And I'm really wondering, and it probably is true, that the emotional, psychological impact on the families is actually deterring the recovery time of some of these infants who have this procedure done. Do you think that could be true, Jim?
Absolutely. And one of the big problems we have is follow-up. I sell a package deal to the parents. It's one price for the procedure, whether it's tongue, lip, both, and it includes all follow-up visits. So I have a lactation consultant working with me, Grace McGill. She and I work to get the technique down for the parents, and we work on that at every visit. We make sure that we have a complete release to begin with, but we have them come back in 2 days after we've shown them how to realign the wound edges. We tell them the dictum of surgery is that wounds heal from side to side, not from end to end. So if you make an incision, no matter how good that incision is, no matter how good the release is, if you let those two edges sit side by side, they're going to reattach. So what we want to do is to move those edges farther apart to keep the side angles open, have the top and the bottom as the diamond is pulled straight up and becomes a narrow vertical diamond, that the top and the bottom will heal 1/2 to 1 millimeter at a time, and then very slowly zip down from the top, zip up from the bottom, and end up with a very thin white vertical line as the healing point. But in order for that to happen, we need the parents to come back to us. We see what they did. Some parents say, I did exactly what you said, and the 12 millimeter diamond that they left with is now 3 millimeters 2 days later, and we have to open that back up again. It's very easy to do, but you have to open it back up again, show them again how to do it, and keep them on track until this is healing exactly the way it's supposed to be. So I would say that 85% of our patients end up with a really terrific result because we keep track of them. We don't let go of them until they're doing exactly what we want and the wound is healing exactly the way we want it to heal. We have some really terrific doctors and dentists here who do a very excellent release, but then tell them just finger sweep underneath and don't worry about realigning wound edges. It'll be fine. And then I get to see them when it seals back together again, and then I have to go through the scar tissue. So it's operator-dependent skill. It's also follow-up, follow-up, follow-up to make sure the parents are doing exactly what you want. And anybody who tells me you don't need to do anything with that wound, it'll heal just fine, they're not doing any follow-ups because they don't know that their patients aren't doing fine.
Yeah, I would agree with you. I sense that we're going to be having to have a lot of conversations about follow-up care because I think it's been an area that, you know, has been neglected, and we're going to need to come up with some really good guidelines and plans, you know, in order to support these families, and that's what we're starting to see in our area as well. But moving along, I want to, there's a comment here from Kathy. She says, ENT have the baby as their patient and not the breastfeeding dyad as we see it as lactation consultants. And clearly it sounds to me, Jim, you are really trying to treat the dyad and not just the patient. When did you first start to notice that this was just vital in your practice?
At the Navy Medical Center when I was doing the releases, initially we had a lot of time for me to see the patients back. And then as we had new business rules imposed on us, we had shorter and shorter time to work with them and fewer appointments to see them back. And then I noticed that they weren't doing as well when I wasn't having the opportunity to follow them up. So when I opened my own practice, I said, you know, if this is going to work, it's going to work because I'm taking total control. And the reason that I'm doing this is to get the baby breastfeeding exclusively and to have mommy say, I really enjoy breastfeeding. And if I'm not succeeding at that, then there's no point in my being in business. So what we find is that so many people, doctors who are excellent at what they do, see that what they need to do is release the tongue tie, and then if you're ever in the neighborhood again, stop in. They're not working on breastfeeding. I am. And Grace and I work together to make sure that they do really well, and when they thank us, it's because I'm really loving breastfeeding. That's the goal, not releasing the tongue tie or lip tie. And for Allison's comment before about the upper lip tie, I think that a tie is a functional impairment. So when the parent tells me that the upper lip curls in, they straighten it out and it curls back in again, I think that qualifies as a tie. But even so, most of them, when I release the tongue tie and I put them back on the breast, and the mother says there's zero pain, everything's wonderful, we look at the lip and suddenly it's lying flat. So the baby with the tongue tie released gets further onto the breast, and a lip that couldn't go flat before now is going flat. And so I haven't had to release as many upper lip ties as I thought I would, because we're doing it in a stepped stage fashion. First we do the tongue tie, then we let them nurse for 10 minutes. Then if there's still a problem, we take them back and do the upper lip tie. And so I could document that it's still a problem before I release it. And I think that's, for me, the best way to go. It takes longer. The visits I thought were going to be an hour, and they're turning out to be an hour and a half, so we had to modify our schedule. But again, the reason I'm there is to make sure that this happens, and we get a mother who's really happy with breastfeeding and a baby who's thriving, not just a tongue tie that got released.
That's so important. So yeah, thank you so much for that. I just wanted to mention that Ruth wants to say, Dr. James, I've learned a lot from your presentation. I do a better job now when I'm examining a baby's mouth. Thank you so much. So you have to know, Jim, that there are many people that are very grateful for your presentation and all the work that you're doing. Okay, now let's just get to, I saw that there was a couple more in here. We've already answered that. Nettie, is Jim able to answer my question on, is there an age limit to treating tongue tie with laser? LA, I'm assuming that's what she means, right?
There's no limit on, you can do it at any age. We have an assessment period of 12 hours after you're born to make sure that you're not having some kind of infectious problem, becoming septic or other issue. So any procedure is deferred until after 12 hours of age. My ideal is that all of the people on the postpartum area are proficient in helping mother to latch. The ones that they are not able to latch then go to the lactation consultant, and in the first 24 hours of life, if this baby cannot be latched by the best skilled person on staff, and they find a restriction underneath the tongue, that needs to be released before they go home, and they should have at least one good breastfeeding in the hospital before discharge, because once you do that, they go home and they do beautifully. The breast goes into the mouth, it pushes the tongue down, it really realigns the wound edges without doing a whole lot. And at USC, they tell me they don't really have to do the wound edge realignment because they have everybody going home with their tongue tie released, breastfeeding beautifully, and the breast pushes that tongue down and puts it in the right position for proper healing. And I just wish I had that opportunity to do that, but I'm dealing with the aftermath of not doing that. But the laser especially, because the older individual will cooperate you when they're not feeling any discomfort. I have no doubt that there's some discomfort when I'm releasing that with the scissors. I've had adults tell me that they did it and it didn't really hurt very much, but very much is a relative thing. So I know that there's causing some pain, and as soon as you get the baby onto the breast and they're nursing beautifully and that jaw is dropping farther than ever before, and the loud gulps or the mom's eyes are popping out of her head, that's what I want to see. And then they say, okay, the baby's doing really well now. I just wish he didn't have that initial period of pain. So the baby that has to be held still to do that, I limit that to about 6 months because Grace is my assistant, and I found that it takes a husky guy with big muscles to hold that jaw down for me to release that. And the older kids, they're just too strong. And the older they are, the more alert they are, the more localized they have the ability to localize pain. And I think that it's a lot harder to do in the older individual with scissors, but probably very easy to do with the laser. And there's just, after 12 hours of age, I don't think there's any time limit on that. I think from 12 hours of age until you're no longer with us, I mean, the elderly can have it released too, and many need to because they've been missed that long that they're drawing Social Security and they're still tongue-tied.
Oh my goodness. Well, it seems like there is still a lot that we're learning, but with your time, like you've had time in on this already, and I surely appreciate all that you've done and all that you have learned and been able to pass on to some of us. You've stirred up quite a few questions, both you and Alison, again for me, and I'm feeling a sense of wanting to readdress in my community, just to make sure that we're doing everything the best we can. And I imagine that over the coming months and years, as we, again, this stays at the top of probably our field for a while, since it's a newer subject, that we're going to be changing how we do things, you know, a lot, you know, over and over again. So it's great to have these conversations with you, Jim, and to continue to get your expertise and your input into this area. So I surely appreciate you being able to join us today. So we have reached the end of your time, but I thank you for being with us, and perhaps you just want to sign out by saying goodbye to our delegates as well, Jim?
Okay, thank you very much. I appreciate the offer to be here and to share what I have, and I hope that I can get other doctors in line to make your life a lot easier. Have a good one.
Thank you so much. Well, thanks, guys. I'm going to sign out just for a second here, and we're going to let KG jump in with Veronique and with Virginia. Are you out there, KG?
I am out here. I've been working furiously in the background, collecting questions, chatting with people in the chat box, and talking with the staff in the background area that the delegates can't see, and having a lot of fun, and also listening to the questions and answers, and loving, you know, the fact that we're actually delving in a little bit deeper. That's one of the reasons why I actually really love the Q&A sessions. So as a reminder to everybody listening, don't forget that if you're an annual member and you have access until June 15th to access the delegates area and listen to all of the recordings, you can also listen to all of the question and answer sessions. And sometimes, you know, it just helps us go a little bit deeper into a presentation topic. So feel free to take advantage of that. Now, before we get started with Veronique, and I hope we are pronouncing her name as correctly as possible, but I do want to point to Virginia. So Virginia Thorley is online with us as well, but we were not able to get her microphone set up today. But Virginia, I'm hoping that you can hear me, because what I've done is I've actually posted the first question for you in the presenter only chat area. That's a chat area that the delegates can't see, but Virginia does know where it is on her screen there. And if you look there at the presenter only chat, Virginia, you'll see that I've posted a question for you. If you can type your answer right in that chat box, I will read it orally, the question and answer, later on. And once I see that you've an answer there to the first question, then I will post the second one, and you and I can go back and forth like that. And there you go. She's answering the questions. You guys don't see it, but I'm going to give you the answer in a minute. So it's awesome. So I'm going to actually ask Veronique to turn on her microphone now, and I have some questions I'd like to ask her. Hello, are you out there?
Yes, I am here.
Awesome, thank you. It's wonderful to have you here with us today. As a reminder to our delegates, Veronique has given a poster presentation at GOLD on babies suffering from gastroesophageal reflux disease, also known as GERD. All right, Veronique, I'm going to jump into the very first question here. Now, your poster presentation included a list of criteria that helps determine whether or not a baby has GERD. We don't really have time to go over that list today, but I'm hoping you can tell our listeners how many of those criteria are needed, how many of them need to be present in order for GERD to be diagnosed. Is it just one sort of symptom, or is it all of those symptoms that you've listed in your poster? Can you give us some clarity on that?
Okay, there are no rules for a number of criteria to be respected, but it is the health of the baby that counts. And some babies have many criteria, and others have one or two criteria. There is no rules. And what is very important is the health of the baby.
Gotcha. Okay, awesome. Thank you for clarifying that. I'm going to go on to the second question now. Is there a defined protocol to use with babies who have GERD? So looking at a baby who's been diagnosed, I know your presentation talked a lot about positioning and how to help the families. Have you drafted a defined protocol, step 1, step 2, step 3, or do you know if there is a resource out there like that?
There is no protocol to manage GERD which is adapted to the breastfed babies. all what is written is about bottle-fed babies, and there is nothing written about breastfed babies. So we have to do with each baby what we can, because each baby is different.
Of course, each baby is indeed different, and thank you for pointing that out. I really appreciated your poster presentation and how it very much focused on the mother and on the family and what the impacts were, you know, in working with a baby that was, you know, feeling a lot of pain and discomfort. So really compassionate there, Veronique, and I appreciate that, that take on it. Now, another question, how do we know if GERD has been misdiagnosed, and what could potentially be going on with baby if it's not actually GERD?
A baby who does not suffer his regurgitations and who goes well, a baby who takes a lot of weight should not be treated for GERD, because it's a normal situation for baby to have some regurgitations. So the only criteria is how is the baby. If he is well, it's not a GERD.
Alrighty then, thank you so much for that answer. Alrighty then, now Ellen had asked a question earlier. She said, how does one suggest administering reflux medications to a baby fed on demand? Nexium has to be given 1 hour before feeds, which is almost impossible unless baby is schedule fed. Really, really good question. Veronique, can you give us some suggestions for Ellen?
Because medication must be mainly taken around meal times. At the beginning, in the middle, or at the end of a meal, or 1 hour before. But breastfeeding is not only about food. Breastfeeding, it serves to relieve, to console, to put to sleep. So it's very difficult with medication. So it's a real problem, because when we want to that the baby have 1 hour between the medication and breastfeeding, it's a torture for the baby who is hungry and in pain, and whom we have to keep waiting 1/4 or 1 hour. So it's very difficult. There is no miracle solution. It's necessary to see with the doctor what is the maximal dose of medication to be taken to avoid overdoses, and accept that a number of feeds will be without medication. It's better to feed without medication rather than to restrict the number of feeds. Indeed, it's thanks to the nursing on demand that the baby has a good weight gain, and the feeding on demand often relieves the baby's pain. If we cannot wait to give a medication, and it's better to give it and not to wait 1 hour to breastfeed the baby. It's not the best, but it's not really a big problem not to wait 1 hour.
Alrighty then, thank you for that clarification. It is interesting how recommendations on how to administer medications, you know, parents really do want to follow those protocols properly according to directions, and sometimes, you know, doctors also don't think about maybe there are other options. So thank you for pointing out that maybe it's not the end of the world, you know, to make sure that, you know, that those meds are administered, you know, 1 full hour before a feed. I guess, you know, that's probably the most ideal, but it doesn't necessarily mean that that medication is going to not be effective if that ideal isn't met. So that's a really great point. All right then, now Amy asked a question. She said, We hear from a number of moms who are told to use the rice cereal protocol to weigh down the stomach contents. Given what we now know about the risks of introduction of non-breast milk substances prior to 6 months of age, what is your opinion on this idea? Veronique?
To give cereal is not a good solution because it doesn't prevent GERD, and it can hide it and prevent that the baby is correctly looked after, and and breastfeeding becomes very complicated if we want to do this. And cereal are going to increase the soreness of ascent in the esophagus, so it will be worse. So it's not a good idea to do this. And the best for the baby is mother milk and nothing else.
Of course, the best for baby is mother's milk. Thank you for pointing that out. We of course know this, but some other people will be listening to this closing ceremony as well, and it is always good to remind us of the basic truths. Alrighty then, I think I have one more question from Joyce for you, Veronique. She says, a doctor ordered the use of a bottle for a baby with GERD. What would be the rationale behind that?
A doctor, I don't understand. A doctor ordered use a bottle for baby? Why?
Exactly. I think that's what she's wondering. We wondered if maybe you would have an opinion on why a doctor would say that a bottle is better than breastfeeding. Obviously, the issue isn't formula per se. The issue is if this baby has GERD, then you must feed this baby using a bottle. So why, in your opinion, would a doctor suggest that?
I think it's because all what is written about GERD is written with bottle-fed babies. So many doctors, it's difficult for them because it's hard to know what to do with a breastfed baby, and how can we give medications, and how can we do some exam. And so I think for some doctors it's easily to have bottle-fed babies than breastfed babies. And for many doctors in France, breastfeeding isn't something which is important. So breastfeeding is not important, so you can give bottle to your baby.
Interesting. It is really interesting, the perceptions that are out there around breastfeeding and lactation. And, you know, there are so many of us working very diligently on, you know, educating healthcare professionals, and especially doctors and others, you know, midwives and whatnot, who are not lactation professionals, but who work with mothers in that perinatal framework. But it is such a heavy responsibility for us to do that. But I appreciate the healthcare professionals, you know, who really do take a stand there. You know, like Allison Hazelbaker was saying earlier, you know, get the information, present it this way, stand your ground. We do have to do a lot of educating in our field, and that's not just educating of the mothers, but it is the doctors and other healthcare professionals as well. So thank you for pointing that out. Veronique, that brings us to the end of our question and answer session with you. So I just wanted to say thank you so much for taking the time to come online today and answer some of the questions that people had with respect to your poster presentation. It's really been an honor to have you as part of Gold Lactation 2014, and hopefully we'll be hearing more from you in the future.
Okay, thank you.
You're welcome. I'll get you to mute your microphone now. And as you all know, Virginia does not have audio today, so we're going to do this a little bit differently. She's been typing furiously in the background, and I am going to just look in the background here for the very first question that we had for her. I'm going to read the question, and then I'm going to read the answer. So hopefully you're not tired of my voice just yet and can take a little bit more of what I'm reading. All right, so we have a question for Virginia, and it was, in your mind, what has been the impacts of marketing feeding products for infants over the years? And Virginia answered, consumers do heed marketing. For instance, my mother took up uncritically, so I think she's meaning uncritically listened to messages from the dairy industry. Mums heed messages that tap into beliefs and fears and tap into emotions. We in the breastfeeding community can learn from advertising, listen and heed mothers' concerns. Then reassure and give evidence-based information, helping rather than selling a product to solve a problem, or even ascertaining that the problem doesn't even exist. So often, advertisers of bottles and teats reinforce the idea of a problem when there isn't one. Ah, Virginia, you are speaking to my soul. That is so true. That is so true. You know, and I think this is one of the reasons why people who aren't in the know or who are not involved in advocacy maybe don't understand the purpose of the WHO code. I'm forever explaining to people that the WHO code isn't, or the HWO code, whichever you call it, isn't anti-formula and isn't anti-bottles. It's anti-mercenary marketing, you know. And when I explain it that way, people are kind of like, oh, okay. But it does take some serious advocacy there. So thank you for explaining again that yes, mothers are sensitive to the marketing messages that are out there, and those marketing messages are trying to create problems so that companies can make a profit. And, you know, it is addressing that fear base. So just bang on, bang on. All right, then. The next question for Virginia was, other than the WHO code, is there now or has there ever been any guidelines regarding advertising products meant for children, especially those making health claims? And Virginia answered, some countries have guidelines, either legislated or not, but they mostly only cover part of the WHO code, not all of it. In my country, Australia, the MAIF agreement, which is Marketing in Australia of Infant Formula, covered part of the code weekly and has never covered bottles and nipples and the retail sector. Now the federal government has axed the monitoring body and its secretariat in November of 2013. There are in some countries, as the US and Australia, bodies that oversee provos. I'm not really sure what that means. Given or withheld for therapeutic devices. I'm not sure if this includes bottle, but it may. So still a lot of work that needs to be done in this regard, and I do think that there are guidelines, from what I know, with respect to marketing health claims or even nutritional claims, and yet it still seems really loosey-goosey. So if anybody else has other information to share about that, would be wonderful to hear from you. All right, give me a second here while I get to the next question from Virginia, but before I do that, I just quickly want to post the fourth question for her in the background here, so she has a chance to answer that while I'm actually giving the question and answer for her third question. So here we go, back to that now. I'm going to ask the next question that was asked of Virginia. Here we go, and this is from Kathy. She said, "Dear Virginia, I loved your talk." Well, it was the poster, Virginia gave a live presentation on Does Breastfeeding Save Lives Today, and she gave a poster presentation on marketing messages. So Kathy was enjoying Virginia's presentations, and she said, sometimes we can feel that there is an endless financial bottomless pit to market formula milk no matter what we do as healthcare professionals. In the UK, I was horrified to find our hospital discharge packs, which haven't had formula marketing in them for many years, are now offering mothers via email a test of her milk. Have you heard of this? It seems specifically designed to undermine a mother's confidence, and so probably good for formula marketing. There is a petition here in the UK about this new tactic. Do you have any thoughts? And have you seen anything like this in your area? And then Virginia answered, I've heard about this test kit in an online forum. I can't remember which one. It doesn't seem to have caught on here, obviously in Australia, where she's from. And then Virginia goes on to say the difficulty in the UK is, of course, the appalling problem of having a hospital promoting it. The question to ask is the hospital receiving money or sponsorship for doing this? Then she goes on to say the purpose of marketing is to create a supposed need when there isn't one. This is from a marketing guru. So exactly, they're looking, and this is KG just commenting here, you know, the formula manufacturers and are just looking for loopholes. They're looking for and constantly finding loopholes. And those of us in the breastfeeding industry, and especially those of us who are involved in advocacy, are constantly having to respond to those loopholes. So it's kind of a sad way of doing things. Alrighty then, one last question here from Rosemary to Virginia. Alrighty then, so, oops, I've kind of scrolled away. There we go. All right, so from Rosemary. Virginia, your talk was amazing. Visiting a maternity unit in a private sector here, the ward sister told me that they no longer use bottles or needed a milk kitchen because they were using boxes of pre-mixed formula. Mothers who chose not to breastfeed are required to bring this premix in with them. Could it be that in disaster times or in the refugee camps, do-gooders will see this as a way of getting around the argument of not being able to sterilize bottle feeding equipment? I know this supply will dry up when the do-gooders leave, but is this premix formula a source of concern? And Virginia answered, it should be a source of concern. But my impression is that it isn't on the radar yet with relief agencies. At least this is as far as I know. Once the helpers have gone, mother and babies are stuck. And then she says in Australia, many hospitals already use that pre-mixed formula. So there you go. That's our question and answer session for today. I wanted to thank our speakers so much for taking the time out of their Saturday to spend some time with us answering further questions from our delegates. And now we're going to move on to the next portion of this closing ceremony. Fiona, do you want to give a little announcement about this slide? No, this slide, nope. This slide. Fiona, it's your turn.
Yeah, where are we? I was getting so absorbed in listening to all of that, I lost track a little bit of time. So anyways, I don't want to keep anyone too much longer, but there's some important things coming up here. And one of them, of course, is the call for abstracts. So it's really important to us that you know about this website, and it's such an easy way to actually do things as well for us, especially if you are involved with research, clinical skills, case studies, ethics, scope of practice, business. You can all read it. Networking. Are you actually doing these things? Are some of you out there actually involved with some of these things? Well, that would be great, because what we need you to do is actually submit an abstract. This is how you could become one of our next GOLD Lactation speakers in 2015. Wouldn't that be phenomenal? One of our very own, as we've seen over the years, becomes one of our speakers. Now, if you're not a speaker or you don't feel like that's your forte, then of course please mention this to your colleagues that you're working with, or perhaps you'd like to nominate somebody and let us know as well. And as you can see, there is a website at the bottom there, but in fact it is not correct. As we noted when we first were checking out our slides today, so it's just a little bit of a mistake. You can see that. So if you go to www.goldabstracts1, okay, so 1 is the number that you're looking for, .com, you can submit your abstract there, and or you can tell others all about that. Abstracts is open till June 30th, so get them in. We're waiting for you. Now, I believe, KG, I'm lost. Are you talking about this now, or was this me? Have we had enough from you?
Yes. I am. But we're just gonna go quickly through the next number of slides there, because we don't want to keep people online for too long. So just wanted to remind everybody to mark January 26th on their calendars. We have our alumni presentation coming that day, and we are actually planning an add-on portion to our alumni talks that is going to focus on ethics. We've had a lot of people ask us to offer more education dealing with ethics so that people can get those e-CERPs, and we've been listening. We hear you, and this is our plan for early 2015. So please mark that on your calendars, and we'll get that happening for you. Alrighty then, Fiona, it is, let's just pass over this one for a minute, and let's go, and we've talked about Veronique, so we'll just move on here. And we'll go on to the next one, and we've talked about Virginia. Alrighty then, so Marianne Vanderveen Kolkina had a poster presentation talking about inner peace, and I went through it myself the other day, and it was just lovely. And I just wanted to read this quote from that. Breastfeeding, eye-to-eye contact, and having emotionally involved others around, not being alone day and night means a lot to babies. It helps their stress regulation, their brain development, and trust in others and self. And it is interesting to know that the social right brain hemisphere develops before the left, indicating the importance of relationships for survival. Such a true bunch of statements there from that poster presentation. A real gem for Marianne to share all of that with us. Alrighty then, Fiona, your turn.
And of course, we heard from Jamie Smith, Laura Odello, hope I'm saying this right, and Ima Melado. So Laura had said, human mothers produces milk designed in part to build the brain that her child will use to navigate a complex world. Just a beautiful quote there. And as you can see, there's another quote. Be proud of being an IBCLC. No matter the number of IBCLCs in your country, all of us are linked by the same objective, the same quality standard, and the same dream. Your pride will expand the IBCLC movement. Just wonderful. And here's some pictures that we wanted to put up for you. Just as a reminder, this conference, we did make note that we had some amazing slides. I know when I was in my room with Andrew, we were often blown away, and sometimes there was noises like, oh, really? Wow. But the quality of the slides this year have been wonderful. So much appreciated again to Alison and to Bobby there for the details that we're being able to see, because honestly, some of us don't get to see this in our areas, and so, you know, this is the first introduction of actually seeing some of these things. So thank you to both of you. And there's a quote there that, oh, there's, did you move on there? We're going to have a look at those now, KG.
That's okay. Go ahead and read the quotes. Yeah.
The foci defined as any structural compromise due to the forces that overwhelm adaptive mechanisms of tissues can create tensional dynamics that mimic both anterior and posterior tie. When assessing for lip tie, remember you're looking for more than just a labial frenulum to be present. You're looking for restriction of the lips when lifted. And that's wonderful to note as well, and a lot of what Alison was talking about today as well. Do you want to take this one, KG?
Yeah, sure. This was from Melissa Cole's tongue tie presentation as part of the tongue tie add-on package, and she was talking about pre and post frenotomy care. And I really appreciated these pictures of the differences that you can see when, you know, with the labial frenotomy with scissors versus with laser, and it just shows you what some of the results are and how it appears very differently. Melissa's presentation was awesome, and I really got a lot out of it. Oh, I wanted to see that quote there. And she said, frenotomy post-op expectations should be 1 better feed per day. So I thought that was one gem that we should really be sharing with our parents. You know, that if they get 1 better feed per day after treatment, then that is a good expectation. So it can take a week or more before every feed is a better feed. Alrighty then, let's see, what have we got here? Alrighty then. All right, Renee Beebe, I think that's how we pronounce her last name there. Sometimes these names, it's difficult to know how to pronounce them properly, and I always feel bad if I'm doing it wrong. But nevertheless, she had a really awesome presentation on keeping, you know, that roller coaster in mind that parents are going through. And she said that mothers often feel guilty and responsible for breastfeeding problems, even if they are structural in nature, such as with tongue tie issues. And it's very true that guilt comes up over and over and over and over again. So Renee's presentation was really helpful in helping the lactation professional help a mother and, you know, a family work through that guilt and the difficult emotions there. All right, Fiona, I'll turn over to you.
Yes, we had Dawn DeSalvo speak about human milk collection, and I wasn't sure initially. She was in our preterm package. Wasn't sure initially what we were going to learn from her. It was an interesting topic, but nonetheless, she really guided us through. Firstly, we talked a lot about how to really ensure that milk was safe in our hospitals, because I think this has been one of the downsides of being able to do milk banking and then using human milk within NICUs and hospitals, is that there haven't been clear protocols on, how to do this well. And then, of course, the scare tactics in the media and, cross-contamination and all those types of things. So she presented very well, and it was great to hear her talk about the successes that she's had in her experience and in her hospital and how this all came about. So, and she, again, just saying over and over, that every baby deserves to have this, that we should have it everywhere. And as you can see at the bottom there where she says, milk is everywhere for all sorts of reasons, and it is true. And every baby deserves to have access to that. So wonderful presentation on just really the dynamics of making sure that we can keep our milk safe. We're in the hospitals, and that we can provide our little ones, if it's not our own, but we can provide to others as well who are in need. And I'm just going to move on to the next one here. So some of you would have had the privilege, too, of listening to Jill and Nils Bergman, and what a dynamic team they are. You can only imagine some of the dinner time conversations that they have after their presentations, especially from Nils, such a detailed scientific mind. I went back, and I had hosted on his session, but I went back and listened to some of it again. And it just blew me away. KG and I were talking about it earlier. Very detailed. I think it's the way he is. He just loves those details. And, perhaps it took a bit of time for those perhaps who got an opportunity to listen or to his presentation would have noted that there was a lot of slides on there. And he actually was able to come in under the 60-minute or just thereabout. But it really was wonderful to listen to genetics and epigenetics from him. I just loved it. It was very mindful. It kind of opened up my mind once again to preterm and such important values in how we change physiologically and psychologically through that whole process from the mother to the baby. So anyways, it was really, really good. And the same for Jill. She's just a sweetheart in all that she does, and the care and quality that, again, she took to do her presentation. But such well-rounded people, and I think it was a gift to have them to us, to listen to them, because they just did a phenomenal job. So first time I've listened to them on a webinar, so kudos to them for doing such a great job. And I'm sure you'll all agree, if all of you had a chance, or some of you had a chance to listen, would agree with me as well. I think you were going to take this one. Yeah.
Yeah, I was. Yeah. So now, as I just loved this quote so much, this was part of our preterm package as well. And we had Dr. Nancy White. And, one of the things that she says in her presentation is what are the indications for human milk? And there's only one. It's being born. And I love that so much. I thought we're going to have to put this on here. And what are the indications for pasteurized donor milk? Well, there's two, being born and mother's own milk not being available. It's that simple. So I loved that quote. That is a quote that we need to start really sharing around the world, all over the place on social media, because that's it. That's it right there, bang on. The indication for an infant receiving human milk is just being born. The indication for an infant receiving pasteurized donor milk, well, is being born and mother's milk not being available. So there's your recommendations. Loved that. Okay, Fiona, let's have a little bit of fun now. Okay, let's have a little bit of fun and go on to the next slide and show people what we do when we're not online or when we are online.
Well, as I said earlier, KG, there you are again, sleeping on the job. I kind of feel bad for somebody whose presentation is that in the background, because you just literally, you slept through the whole thing. I'm going to report you.
Meg, it's Meg Nagel. It's her triplet one, I think.
That was very naughty of you, napping in between times. Okay, so you can see KG is absolutely sleeping on the job. Who is that in the top left-hand corner? Do you recognize that man? Holy smokes, that is our very own Dave Venus, and there he is. Is that a fake grin? Come on, Dave, do you always look like that? Is it just kind of like placid? It's placid on there. Oh no, he's probably got one of those sleep aid things in his mouth that just makes you sit your cheeks like that or something, right? Stops you snoring at night? I don't know. Anyways, that was one of the photos that was submitted for the Selfies Award. As no one voted for it, so he didn't win, unfortunately. So sorry, Dave. Maybe try again next year. And then there, down below in the bottom, well, there's our sweet Fleur. Now, Fleur is part of our team here, and she got to do some hosting this year, which was fantastic. But a lot of her work is very dedicated to the background here. So we wanted to make sure that she was mentioned for sure today. And there she is. She looks very proper at her desk. Look how organized her desk is. Can you believe that? I don't believe it looks like that at all. It's way too clean. I'm going to have to talk to her. She obviously, that was definitely a fake shot, I'm sure. Too tidy, too tidy.
Well, when I look at that photo and I see my own desk with papers everywhere, and I actually prefer things to be tidy, but I'm too busy to be tidy. So, yeah, I'm thinking, I don't know, Fleur is making me look bad here. But I see Angela, she's like, what is that stacked up next to KG on my desk? And it's hard to see because Fleur's photo is in the way. But those are the little Snappies containers that we give out with our logo on it. We give them out at conferences and stuff just for fun. And anyways, that's what that is. So if you're going to be at ILCA or one of the other conferences that we're going to be at this year, make sure you stop by the booth. Angela, say hi. We'll give you a hug, and I'll give you a handful of those things. You can put candies in them or chocolates or something.
Yes, always something good. Always something good, for sure, for sure.
Yeah.
Okay, let's move on here. Oh, do I get to talk about this?
You do.
Oh, good, because where's my drum roll? I kind of wanted to do a drum roll now. This is very important, I'll have you know. Okay, so I know we've had this big countdown today for everybody, but guess what? It does not need to end right now. That's right, that's the great news. If you become a gold member today, you will get a 2-week extension for viewing. And some of you have probably just totally been relieved by that. You can actually go on and listen to the recordings for another couple of weeks. You can also save 10%, as you can see on our up-and-coming conferences and other events. You can log in any time of the year, anywhere you like. You can download your certificates. You can download your receipts. It is wonderful. So for a small fee, the drum roll. Dave lost the drum roll. Someone dumped it in the trash can. It's gone now. So for a small fee of just, is it $50? Somebody quote me right on this before. Yeah, okay.
Yep.
So for $50, you can get your extension and then, of course, get your 10% off. So it really does pay you back to get that. So if you feel like you really are a bit overwhelmed or you just want to have an extra listen, perhaps you didn't get the opportunity to really absorb all the information that you wanted to, then this is your opportunity to do that right now. So please, please just bombard Andrew, because really, what has he done today? Not much, really. Has he done anything? I'm not sure. Anyways, he's kind of sitting back there. I think he's got his feet up on his desk right now. Note that he did not send in a picture, and apparently they lost mine. So there is admin@goldlactation.com, and Andrew would love to see your email on that, and he can certainly help you get involved in some of that. Okay? Now, anything else? Let's see, what else have we got? Oh, yes, it says don't forget to renew. Okay, so you know that you need to do that. Hopefully Andrew sent you your renewal. Okay, let's move on. Okay, G, this is you.
Yeah, I was just going to talk about social media for a minute. Now, you know, a lot of the people that are online with us today and that will be hearing this presentation on our website are already engaged with us on either our Facebook page or our Twitter profile. Those are the ones that we tend to use most often. We do also have a Pinterest board that we do post things on from time to time, and every now and again I'll message people on LinkedIn. But really the two most active social media pages that we have are on Facebook and Twitter. Now we do have different accounts for Gold Lactation and a different one for Gold Perinatal. So I would suggest that you join all of those pages because we do post different things on them from time to time. Naturally, the lactation one is breastfeeding focused. The perinatal one is, you know, pregnancy, birth, and postpartum focused. So different information goes on those boards. But, you know, one of the reasons why it's really awesome to get online with us is because it's a great way to connect, you know, if something goes down with the website, or if for some reason you can't log into a presentation, or when there is no event happening, you can stay connected with us because we do give announcements on our social media profiles. So what we have noticed, Fiona, is that some of our users are not getting our emailed newsletters. Especially Yahoo is giving us a bit of a hard time this year. Sometimes they just assume that we're spamming or sending junk, which of course we're not. We're sending important information that our customers need to know about. But, you know, just being with us on social media can make a big difference to ensure that as interested parties that you're getting the information that we're sending out when we're sending it out. So just keep that in mind. I know some of you aren't that fond of Facebook or social media, but even if you only go on now and again just to get some news items from us, that would be awesome. Alrighty then, where are we now, Fiona? Let's see. Oh, where will we be? I think I'm going to talk about this. Where will we be this summer and fall? Well, Fiona, we know what's coming up next, don't we? We're going to be exhibiting in the exhibit hall at ILCA, which is the International Lactation Consultants Association Annual Lactation Conference. It's in Phoenix, Arizona. So if you are planning on going there, please stop by our booth and say hello. We are in the planning stages, you know, to plan some sort of delegate, you know, and customer recognition, whether we have like, you know, a champagne reception or something like that. We're not sure what we're going to do, but we're going to do something to bring, you know, our customers together and, you know, say, you know, let us all sort of connect while we're there. So please say hello if you're at ILCA. And then, of course, we're also going to be at the NAN conference. Now, this is, what does this stand for? The North American, oh, something about neonatal nurses. Maybe somebody can help me out here. Are there any members? Anybody here a member of NAN? But we're going to be exhibiting at their conference, also in Phoenix, Arizona. I always like to joke and say that, you know, when I started to travel for business and exhibit, I thought I was going to see the world, but everything is either in Melbourne, Australia, or Phoenix, or Orlando, Florida, or somewhere I've already been, so I don't really get to see the world. But also then in the fall, in October, we're also going to be exhibiting at the Maternal Child Health Conference in Indianapolis. So if you're going to be at any one of those events, please come and say hello. Well, we have reached the end. I want to thank everybody for listening today and for being online with us today. It has been wonderful to have you here with us and participate in our question and answer session. And Fiona, it's always a pleasure being online with you and talking about what's going on in the industry as well as with GOLD. And thanks for being with us today.
Yeah, thanks everybody. It's been an absolute pleasure once again, and we look forward to seeing you at our next big event in the fall here.